we're going to be talking bloods, but it's not me that's going to be talking. I'm going to introduce you to Peggy Daly. Peggy, it's lovely to see you.
Thank you, Kay. It's a pleasure to be here too.
Peggy, could you introduce yourself and your role and what exactly you do?
Sure, exactly. I'm a naturopathic doctor and I live in the States. I'm also a nurse practitioner and I'm one of the medical science liaisons at Boston Heart Diagnostics. I also have a private practice where I see patients primarily with cardiometabolic diseases, a lot of autoimmune, thyroid things, those kind of disease processes.
And you happen to know a lot about blood tests.
Oh, we try. Yes.
So could you tell me about Frontline, what would be the most important blood tests that you would ask our patients to have done?
Oh, for peripheral vascular disease. You know, Kay, there's so many of them. It's going to be hard to touch on all of them today, but you know, some of the ones that I think are really important are things that really look at the lipids and the quality of the lipids. It's not just getting an LDL and a triglyceride and HDL. We need to dig deeper. And some of those things that I would categorize in the lipid bucket, if you would, are particles. And you know, I know most of those viewing today are patients, but I think you can still grasp all this. And when you have bad particles, we can kind of call them bad particles that set up that disease in the vessel lining that creates plaque and then later your vascular disease. We need to know about those particles. So we need to know how many there are and then the quality. Are they large or are they small? And we can offer that at Boston Heart to tell you about the ApoB. That will tell you about all the particles that are causing problems in the vascular system. And then those small, dense LDLs, the SD-LDLs, those are like those little BBs that get into the vessel lining and start recruiting all those other factors that come into forming plaque that causes the vascular disease. So we do have a really great way of assessing that at Boston. There's other things in that lipid bucket. One of the other things that comes to mind is Lp(a), and you've probably read about that or heard about that before, and it's genetically influenced. So you get some genetic things from your parents on both sides of the family, and you can have that elevated in your body. What that means is when it's elevated, it causes additional risk. You can have normal LDL, but you have that Lp(a) elevation, and it causes more risk than the LDL does. So when you have that, it's really important that your doctor evaluates that because it brings very specific risk to you. It causes increased vascular risk, which we know about. So you have to get everything else just perfect when you have Lp(a) in terms of vascular risk. And it also causes calcification or a buildup of calcium on one of the very important valves in the heart, the aortic valve, which is a really high pressure valve. And that one we really, really want to protect, as we do all valves, but it's a really important one to assess. The doctor can assess that by doing an echo on your heart, by listening with a stethoscope. So it's really important that that assessment be done as well when you have that Lp(a). And then there's also clotting risk. Now that is controversial right now. There was a new paper that came out about a month ago now suggesting that, well, maybe it doesn't cause that much clotting risk. I still see that in patients. So I think that's a bigger issue that we're going to need to do some more trials and some more data research on. But right now we're still saying, yes, it does cause increased clotting. And so we need to assess all those other clotting things in patients that cause vascular issues. So thinking about some of the genetics, you've heard factor V, factor II, MTHFR, all those other things that we need to think about for clotting risk. So we assess that as well for patients. So just some of those things in that lipid bucket. And then there's other buckets that we look at. I'm sure, Kay, you talk about diabetes, right, with all your patients. Yes, and that's something that Boston can really dig deep into. We have really a wonderful panel for diabetes markers. And that really is important, knowing about your status for your blood sugar and your insulin. Not just the blood sugar if you prick your finger at home and you know, oh, it's 100 or 70 or whatever, but what happens over the long period? So we have measurements that you can tell about what's going on over the past 3 months, what's your average, and that's a hemoglobin A1C. Then we have something called a glycated serum protein that will tell you what's your average blood sugar for the last 2 to 3 weeks. And we have ways to assess your risk of progression to diabetes. If you're not there now, where are you? And so we have some things that look at insulin levels, because that's so important. You can have normal glucose, but your insulin can be sky high. Yeah. And that insulin causes so much vascular damage. And people don't even know because nobody looks at it. Yeah. And that's why we just plead with doctors, please do a deeper dive. We need to know. We need to know all that. So I'm sure we talk about that all the time as well.
We do. I mean, it's like shards of glass going down through your arteries, and it's definitely something. I mean, 3 in 5 diabetics will have peripheral vascular disease.
Yes, exactly. So it's a big factor. It is
definitely a big factor. And of course, there's other things that we have to take into consideration, like kidney failure. Is there tests that you offer for that one as well?
Yes, we have something that I really love. It's called a cystatin C. And it's a test that picks up kidney issues in the early stages, because most of the time, by the time the doctor literally stumbles into the fact that they're having problems, they're way in stage, at the end of stage 3 or 4 before they discover it through the routine labs like a BUN and creatinine. And you'll get that in most chemistry panels. Yeah. Doctors will see that. But those are things that are, kind of near the end. And we want to find things in the beginning so we can deal with it. And there's such a correlation between vascular disease and renal disease. Yes. And so we need to pick that up. We always have to be looking for that. So we have a test that you can find that earlier. And that's why I love Boston Heart. I love working for them, because I love using these tests, because I can find things that I never could before and help patients and prevent some of the disasters that are normally ahead if we don't act on it. Yeah. So it's really good.
And if I was to go to my GP, my family doctor, how would I convince my family doctor to actually sign up with yourself and allow me to have these tests done? Is there a number he can call so that he can actually be able to join up with you and be able to offer these tests?
Oh, absolutely. We have different reps around the United States, and those reps will go to their office and help them, look at what we have to offer and help them put panels together for their patients and sign them up. But to get to those reps, the doctor would just call one number, our customer service number, and I can give that to you. It's a 1-888-799-8711. And once they make that initial call and talk to the customer care team, who are wonderful people, the customer care team will reach out to the rep and say, Dr. So-and-so would like to know more about Boston Heart testing for their patients. And then the rep will reach out, usually within that day or the next day, and start them on a process to get signed up. And it's a small process. They just need to fill out a little bit of paperwork, which the rep can actually do 90% of it for them. And then they're on their way. And then once they do their testing on their patients, they can always call. There are 2 of us, Ann Sims and then myself, Peggy Daly, and we're the medical science liaisons with Boston. And so they can call and ask for a consult. And then we can help them interpret some of the labs that have been drawn, and help them learn if they need additional testing. We can kind of say, but this test relates to this one, and we really need to find out this piece of the puzzle, because it's like putting all these puzzle pieces together to help people in the most effective way. Yeah. So
could you just repeat that number, Peggy, because it's so important that our patients know that number?
Absolutely. 888-799-8711.
Wonderful. That is absolutely wonderful. Peggy, thank you so much for talking to me today. And I wish you all the best. And hopefully all our patients will go and start nagging the doctor to dial that number. Thank you so much.